Hello everyone, welcome to IMPOCUS. I'm Christian España-Schmidt and we're gonna talk about ultrasound basics and the ultrasound screen part. In this case, I want to always ask you to subscribe and like the videos so we can reach more people who are starting their point of care ultrasound path and also who are looking for more information about point of care ultrasound. In this case, we're gonna use a phased array probe and we're gonna start in cardiac mode. These are the parts that you should be aware of a probe. The first one is the probe indicator. The depth scale, as you can see, there is a depth scale that goes in centimeters. The probe indicator is set in cardiac settings, and that is a reflection of what you're doing with your probe. Very important to know. And the grayscale, this is a grayscale picture. This is a very abnormal heart also. As you can see, the array is like a triangle. So this is what tells you that this is a phased array probe. Please look at our other video on how other probes look like. Now we are going to see an M mode again in phased array. So this is an M mode, as you can see, is the same, is another heart, and we are evaluating the posterior leaflet of the tricuspid valve. And these are the parts, again, your probe indicator. This is where the probe and where the image is in the screen. As you can see, this is a cardiac setting. We have a depth scale, we have a grayscale, and we then have a depth scale that goes exactly with that line or pointed line that you look there. And this is M mode, and that line is what is being sampled and giving us the movement of the structures within that specific line. Also, there is a time scale. So there is -4, -3, -2, -1 second. And you can see that it's going at 50 millimeters per second. So if you were to use a caliper, you could actually measure the time in between events in this M mode. And again, this is the part that we are sampling. Everything that you see in the lower part of the screen that looks like waves is part of the whatever is moving within that line. First, we have the skin that is not moving. Then we have parts of the right ventricle. Then we have the right ventricle in per se. Then we have the posterior leaflet or the annular part of the posterior leaflet of the tricuspid valve. And then we have the rest of the heart. Our point of interest is the annular part of the tricuspid valve. Then we have color Doppler. Again, we're using a phased array, but you can see that the probe indicator is in a different position. And that is because this is an abdominal settings. Again, we have a depth scale. You can see 15 centimeters. That's what we're sampling here or we are looking at. And then we have a Doppler scale. As you can see, the Doppler scale has red on top and blue on the bottom. That is because the red is going towards the probe, and this is how it is telling you. And whatever is blue is going away from the probe. What we are seeing here is an hepatic vein that has regurgitation. This is a very abnormal ultrasound. And what is happening here is that you have blue sometimes going away from the liver towards the IVC, and then you have areas that are red that are going, is regurgitation essentially towards the liver. We also have the velocities of the Doppler sampling. So depending on the settings, you will have a different sampling. And this is very important because Whatever is going above these sampling velocities will not appear either as blue or red, or will appear like areas of confusion for the probe with different colors. And that is because it's going beyond the sampling speed. This is called aliasing, and that is called the Nyquist limit. So the Nyquist limit here is 26 centimeters per second. We will have a video specifically about that ultrasound artifact. So again, this is the velocity of the color Doppler. In the Doppler area, you can see that there is a triangle, or more or less a triangle, and everything that is within the triangle is what we are sampling. That is very important to know. The next one, we have a pulse wave Doppler with a phased array, and again, you can see that this is triangular shape, and we can see our probe indicator is in abdominal setting or normal setting. This is not a cardiac setting. And we are sampling a portal vein. Again, we have a depth scale, and then we have a Doppler scale. You can see that anything that is on red is going again, is going up and going towards the probe. Anything that is blue is going away for the probe. Actually, you can change those settings, and this is very important. You can change those settings, and you can see now that we have a spectrum. In this spectrum down, you can see that there is a velocity scale. That velocity scale tells us about the velocity of the flow where we are sampling. And you can see that there is a small plus sign within the velocity, and that plus sign is telling us that the velocity at that moment was 20.81 centimeters per second, which is why we need this type of ultrasound, or this type of mode, so we can know the velocities of the flow in certain areas, and that can help us a big deal, especially in internal medicine, figuring out volume status and figuring out patients who may or may have portal hypertension. In this case, there will be differences. We will have a video about that. Again, we have a time, and in this case, we have -6, -4, -2. You can see that every time it's going 33.33 millimeters per second. So that's a time scale that we have. So we have velocity, we have time, we have our Doppler scale, and of course, we have our indicators of the velocity of the color Doppler, although these are not so important when you are doing the pulse wave Doppler. So the pulse wave Doppler sampler, if you have not been able to see it so far, is that specific part. You can see that there are two little or larger minus signs or lines, and sometimes you can see a small square. It depends on the brand of the ultrasound, and this is exactly where this flow is being measured. Of course, there is other type of Dopplers, such as a continuous wave Doppler, that will measure everything that is happening within the sampler. But in pulse wave Doppler, which is the one that I use the most and point of care ultrasound use the most, that's where the sampling is coming from. So that velocity in that spectrum that you are seeing in the bottom is coming from there. And of course, we have the Doppler, color Doppler area, which is important. In some ultrasounds, you can actually widen it or decrease it depending. Or of course, in the ultra portable ultrasounds, it's usually impossible to change it. Again, subscribe and like so we can reach more people. And of course, keep scanning. The most important thing in to master point of care ultrasound is practice. You need to practice, you need a mentor, you need to go through some books, follow our channel, and get feedback. Get feedback from your images as much as you can. You need to get feedback and you need to practice. So keep scanning, make this part of your physical examination and improve the care that you're giving to your patients, and also improve your satisfaction with the patients.